COVID cases are exploding across America, and now New Mexico shows how bad it can be for all of us. The governor there says she'll soon allow hospitals to move to crisis standards that allow them to ration care. Patients who have the best chance of survival get treatment. Those with the worst are left to die. Nightmare, once unthinkable prospect. The most serious emergency that state has ever faced, says the governor there, LaJuan Grisham. ICU beds are beyond capacity, and the state has more than 43 people per 100,000 hospitalized for COVID. That's fourth highest in all the land. Dr. Vin Gupta now, an ICU lung doctor, professor at University of Washington's Institute for Health Metrics and Evaluation, also an NBC News medical contributor. Doctor, New Mexico had done so well, really. They'd acted so aggressively to bend the curve, and now it's beating them. Is this coming to other regions, potential care rationing?
Good evening, Shep. It was good to see you. Short answer is yes, it is. And what we're seeing here at IHME, we just published new forecasts suggesting that 44 states by beginning of December into early February, we're expecting in this 2-month window here, 44 states to have high or extreme stress and ICU capabilities. So what does that mean, Shep? That doesn't mean we don't have a ventilator for a patient or a bed. It means, do we have enough ICU docs, nurses, and respiratory therapists? I'm hearing this across the country from my colleagues. The Society for Critical Care Medicine is cutting disaster credentials for folks like myself and my colleagues to descend on South Dakota and their stress health systems. This is a fact of life, and this is one of the reasons why we're anticipating about 500,000 Americans will lose their life in total by the end of February, because we're care rationing, because we can't get people the care they need at the scale they need, given how out of control this pandemic is.
Doctor, in California, as you know, there are 34 million people under new lockdowns now. There's a backlash, and it's significant. Are these restrictions, draconian restrictions, some would call them, are they worth it medically? Do they actually work?
This is what I'll tell you works, Shep. Some of it's going to sound familiar, some of it's a little new. Obviously, high quality masking everywhere in public for all of us. So that means more than just the neck gaiter or the 1-ply mask, that 3-ply blue mask, vital. Face shields if you're 55 and older, vital. Hand hygiene. Here's the things that we also know work.
A mask and face shields if you're my age?
55 and older, we're thinking there's compelling data to suggest that that added layer of protection, if you're older, can be helpful, even in public settings like a grocery store. What I'll also say is we hedged a bit in public health for a few months about, is it okay to travel? If so, what are the parameters? People are traveling, and that's the big concern here. I care for many patients whose loved ones traveled, maybe prior to Thanksgiving, inadvertently passed on coronavirus to them. They didn't do well with it. So no common sense things that don't necessarily interfere with all personal liberties. Like right now, no travel, certainly no plane travel or bus travel. Minimize any type of gathering. If you have to do it outdoors. No indoor dining. And you can still send your elementary school age children to school. I think these are unfortunately the parameters we have to abide by. Do I think they're draconian? I think they're common sense. And I think if we can keep to those things, we'll be able to mitigate transmission until vaccines actually gets deployed in the near-term horizon. But
we're not doing that. I mean, we know we're not because we can see the Thanksgiving numbers. And Fauci said today, we're not even at the Thanksgiving surge yet, and already it's a historic disaster already.
Well, and this is why people need to change their mindset here. We have relief in the medium term. The next 2 months here are disaster mindset. You said it. I'm an ICU doc in the reserves, in the U.S. Air Force reserves. We haven't leveraged all our capabilities here, Shep. We should be deploying those resources, military, National Guard, you name it, disaster credentials for anybody who's trained appropriately in ICU medicine. We need all hands on deck here, but we definitely need cooperation on the behalf of the American people. This mindset that it's not going to affect you, it's going to affect the next person, that has to go.
Dr. Gupta, all the best. Thank you so much. Shepard Smith here. Thanks for watching CNBC on YouTube.